I'm Kim Reddy. I am from Melville, Long Island, New York. I'm a fourth generation business owner, White Post Farms. I help and run the business. My mom was a breast cancer survivor. Ever since the last 20 years, I was always followed very closely by her breast surgeon. In 2018, I was diagnosed with a very high-risk lesion that needed to come out, and it was similar to what had given my mom breast cancer. It was a scary decision. It's something you don't take lightly. No one should ever take that lightly. You really need to process and think, and I felt that I had the 2 years to process and think about it.
Kim's case stands out in my mind because the first thing is she came in empowered. She knew what she wanted. She needed to do a preventative mastectomy because she was at an increased risk of breast cancer. So she had made the decision.
I felt extremely connected when I went in to meet with Dr. Tanna the first time. Thorough is an understatement, knowledgeable, compassionate, and so easy to relate to and work with. When I had gotten my first testing back from hematology and they told me I had factor V, Dr. Tanna was the first to call me. I was due to have 3 surgeries with Dr. Tanna, and it was my first surgery, and he said, well, it's not going to affect your first surgery, so we're gonna move forward with this, but we need to talk about this later. And I said, okay.
Kim has a clotting disorder. She's at a higher risk for clotting. When you're transferring tissue in a flap to reconstruct the breast, you're essentially connecting artery to artery, vein to vein. And the key is to maintain that patency or make sure that those blood vessels stay open.
I wanted a deep flap surgery because I wanted to use my own tissue. There was something about it that I just was not interested in doing it any other way. And I was willing to take my chance with that because my faith is definitely bigger than my fear.
In an inspiring way, Kim asked, is there a way to do this? There must be something. And I said, I don't know. I really don't know. But I'll get back to you.
I had full confidence. I felt that he was selling himself short because he's a very confident, a very good doctor.
And we did her surgery, and it was stressful, but it went perfect. The flaps worked. She got the reconstruction she wanted, and she looks and feels great.
I truly feel very blessed in my life that I landed with the Northwell team. When I think of Dr. Tanna, I smile. He's not only a doctor to me, he's now a friend. People look at me and say, I can't even believe you had that done. You look just like yourself. I not only look like myself, I feel just like I did before I got it done.
And without her knowing it, she basically has paid it forward to every other woman that comes in the future with a clotting disorder. And that's what's incredible, is that one patient and one surgeon or clinician can actually change the course of medicine. And if you really look at it, it's one patient.
Together, we did this, together. And I will never forget that.